Hello, clinic owners. So this week, what I want to talk about is a common thing, a common complaint I see, and that is I can't get my patients to rebook, or more likely, the clinic owner comes along on a call and says, I can't get my staff to rebook their patients. When they come to me, it's no problem, but my staff don't seem to be able to get their patients to return. They don't have as high a patient visit average, is what we call that. So there, I don't know about you, but I used to find that early in my career, I would have a patient who would come along and the patient would have a chronic condition and they might be crippled. They'd tell me, I'm crippled, I'm in an awful lot of pain, it's very frustrating, etc. And I knew I could fix it. And I knew what I needed to do. And I would tell them what they needed to do and I'd tell them all the science behind it and everything and so on and so forth. And then that patient wouldn't book. They go out to the desk. They'd tell me they're going to book. They go out to the front desk and they wouldn't book the call or book the appointment, I should say. And I used to find it really frustrating because I knew I could help them. They knew I could help them, but for some reason they weren't going ahead, even though rationally both them and I both knew it was the right decision for them. So if that rings a bell with you, and I'd say it does with most clinic owners, certainly with their staff, what we're looking for as clinic owners is we want a system that ensures that patients say yes far more often than they say no. And what you tend to find is that the clinic owner, with experience, the longer they're at it, they tend to have a very high rebooking rate, and they're not really sure why. Okay, so they're good at getting people to book people in, even if they're skeptical. Whereas the more junior staff are not able to do so. So what you need is a system that all of your staff can use, can learn, and can use to get that patient to say yes, even when they're the most skeptical kind of patients. And this is something we do and we teach our clients how to implement into their business. So I want to make 3 points on this. The first point is that clinic owners and clinicians are taught to think scientifically. We're scientists, really, aren't we? So what we do is we use rational thinking. So when the patient comes in, what we do is we explain everything from a rational viewpoint because that's what is rational. But the human brain does not always act rationally. In majority of cases, especially when it comes to complex decisions, and healthcare are complex decisions, lots of big words, we don't act rationally. What we do is we'll often act irrationally, and we don't always make the decision that is in our own self-interest. Okay? And think about that patient that came in and didn't do what you told them to do, even though you know and they knew it was the right thing for them. That is why, because it's not in their self-interest. The second point I make is that really, when humans make decisions on complex or high price purchases, now high price purchases is essentially anything you're giving because you're not, I presume you're not giving a treatment for $10 or £10 or whatever. So it's high price purchase. They make them based on emotion. So what we do is as humans, we make emotional decisions and we rationalize it after we've made it. Okay, and that is the same thing that's happening inside in your clinics. And the more skeptical the patient is, the more that's involved. So what we have to do is we have to, as clinicians, find out what is their emotional buying decision, what's their emotional goal, and what's their emotional buying decision. Once you find out what their emotional goal is and what's their emotional buying decision, then what you do is you will get that and you'll add into it the psychology of persuading somebody to take the right decision. And the great thing is because you're a clinic owner and you're a scientist is there is stacks of research that shows us the science of persuading people to make decisions. Now you've got two choices when you know this. When you've studied psychology, and this is something we teach all of our clients, when you learn the psychology of this, you've got two choices. You can use it to manipulate patients, and I can't stop you to doing that. But I know that's not what you're going to do. Or you can use it to influence people to make the decision that is best for them. And when you do so, what you will end up with is a higher rebooking rate, a higher case acceptance rate, and you end up with better results for your patients because they do what you need them to do. And that can only benefit your patients, which in turn can only benefit you and your business. So to recap, your patients do not make decisions rationally from their health. They instead use emotion. If you study the psychology of decision making that we all humans use, and you use it inside in your clinic and you turn it into a system, which you absolutely can, then you get greater case acceptance, greater patient results, greater profitability, greater rebooking rates, and a better business. Now, if this is something you're interested in, this is one of the many things that we teach our clients in our coaching program. If this is something you're interested in, then your next step is to book a 5-minute phone call with one of my team where we will have a chat with you. We'll see where you're stuck, where do you think you need some help. If we think we're the right people for you, we will move you on to the next step, which is a call with myself. We don't do sales calls. And if we think we're not the right people for you, we don't think we're a good fit for you, then we will point you in a different direction. We have other options with other places that we will send you to, because we don't want to take on people that we think we're not going to be able to help. So if that interests you, wherever you're watching this, book that 10-minute triage call, have a chat with one of my team, and let's go from there. Until next time, this is Laura O'Donnell signing out.